Have you ever heard of white water disease that affects the eye? Do you know what the symptoms that may indicate this disease are? So do you know what is the danger of white water on the eyes? What are the risk factors that may increase the risk of developing the condition? Follow these videos, dear, to know the answers to these questions. What is a cataract? A cataract is a clumping of the lens that is usually clear to the eye. For people with cataracts, seeing through a cloudy lens is somewhat similar to looking into a frosty or hazy window. Initially, light and strong glasses can help you deal with cataracts, but if poor vision interferes with your usual activities, you may need cataract surgery, which is known as cataract surgery. Fortunately, cataract surgery is generally a safe and effective procedure. The danger of white water on the eye. Most cataracts develop slowly and do not bother your eyes early on, but over time, the cataract will eventually interfere with your vision. The danger of cataracts to the eyes is mostly because the cloudy vision caused by the problem of cataracts can make reading or driving a car difficult, especially at night, or even more difficult to see the expression on the face of the person talking to you. The danger of cataract on the eye for diabetics. A cataract is a common condition in patients with diabetes, and cataract surgery is a good treatment for that condition, but there is a slightly higher risk of developing more serious problems with the operation, such as diabetic retinopathy. How can white water be treated? 1. When your eyeglasses cannot correct your vision, the only effective treatment for a cataract here is surgery. Talk to your doctor about whether or not the surgery is right for you. 2. Most ophthalmologists suggest considering cataract surgery when cataracts begin to affect your lifestyle or interfere with your ability to perform normal daily activities, such as reading or driving at night. 3. It is up to you and your doctor to decide when to have the procedure. For most people, there is no rush to remove cataracts because they usually do not harm the eye, but cataracts can worsen in diabetics. 4. Delaying the procedure generally won't affect how well you restore your vision. If you decide at a later time to have cataract surgery, take some time to consider the benefits and risks of cataract surgery with your doctor. 5. If you choose not to undergo the operation, your doctor may recommend periodic follow-up examinations to see if the cataract is progressing. Now, dears, after you watch about the danger of cataracts on the eyes in general cases, and for diabetics also in particular, if you have any other inquiries, you can consult your doctors.